What causes psychosis in autism? What causes psychosis in individuals with autism spectrum disorder? This is a question that many people have, as understanding this connection can help provide better support. Psychosis in autism can stem from a mix of genetic, neurobiological, environmental, and developmental factors. Let's break this down in a way that makes sense. First, there are genetic and neurobiological links. Research shows that autism and psychosis share some genetic risk factors. Certain genetic variants can affect how the brain develops and functions. This means that some individuals with autism may have a higher risk for psychotic illnesses like schizophrenia. The pathways in the brain that influence both conditions may overlap, making some autistic individuals more vulnerable to psychosis. Next, we have stress and environmental triggers. Stress can significantly impact autistic individuals. They often navigate a world that is not designed for them, which can lead to high stress levels. When stress becomes overwhelming, it can trigger psychotic episodes. The brain's response to stress can disrupt normal processing, leading to symptoms associated with psychosis. Trauma, particularly during childhood, is another important factor. Experiences like bullying or abuse can increase the risk of developing psychosis in autistic individuals. Trauma can affect brain circuits that regulate emotions and perception, making psychotic experiences more likely. Developmental and symptomatic overlaps also play a role. Some traits associated with autism, such as difficulties with speech or social communication, may increase the risk of psychosis later on. These traits might serve as early indicators of potential psychotic symptoms. Cognitive and social processing differences are another piece of the puzzle. Autistic individuals may struggle with understanding others' mental states or how to explain events. This can lead to psychotic symptoms, such as paranoid delusions, because their interpretation of reality may be affected. Finally, autism often co-occurs with other mental health conditions like mood disorders or bipolar disorder. These conditions can also carry a risk of psychosis, which can further increase the likelihood of psychotic episodes in autistic individuals. Recognizing and addressing psychosis in autism requires careful assessment. Some behaviors seen in autism can look like psychotic symptoms, making diagnosis challenging. Early identification of risk factors, such as trauma history or high stress levels, can guide timely intervention. Support strategies that reduce stress and provide trauma-informed care can help lower the risk or severity of psychosis. In summary, psychosis in autism arises from a mix of genetic predisposition, brain development differences, environmental stressors, and cognitive processing styles. Understanding these factors can lead to better support and treatment for autistic individuals experiencing psychosis.